Hi guys, and welcome to the relationship between dominant and non-dominant limbs in static balance through females. This presentation is part of the Applied Exercise and Sports Biomechanics course. Within this presentation, we're looking at trying to determine what is the dominant and non-dominant limb through balance, and through this, what we determined was your dominant limb was the limb or the lower limb used to stabilize and provide support during a kicking movement, and your non-dominant limb was the lower limb that you would use to kick a ball. So it's a little bit different to what we'd use if you're looking at it from a strength factor. The research says that with balance, it's the process of integrating information from the visual, the vestibular, and the proprioceptive systems to provide a muscular response. Now, the vestibular system is the major contributor to our balance system, and it also provides our sense of spatial orientation. The other research has shown that deficit in lower limb strength and postural control can increase your risk of injuries to knees and ankles. So talking ankle sprains and injuries like that. What we also were looking at trying to determine was whether vision played a major role in posture maintenance and postural control, as it is a major part of the integrating information process. The data collection was done using an AMTI force plate, model number BP800. Within this test, our participants were to hold a single limb static balance test with their non-supporting limb held at 90 degrees for 30 seconds. Through that, what we would do is we would time the exercise. If the participant was to fall, the timer would record the time, and that would be applied to the results that were coming through from the raw data. Our participants would complete this static balance test through an eye open condition and an eyes closed condition. What we're looking at trying to do is see if there was any changes with static balance when the eyes were closed and there was no visual or sensory input from that. With our results, we had 11 female participants with a mean data average of 25.9 years, plus or minus 6 to 7 years, average height of 169.5, plus or minus 6.1, and mass of 65.3, plus or minus 9.5 kilos. Within our data, what we found was that there was a significant difference between participants when they performed the exercise with their eyes open to when their eyes were shut. And the data that will be placed up here through the slide will hopefully demonstrate that change in the displacement that we recorded through dominant and non-dominant limbs. What we're looking at trying to establish is some discussion points for this, and static based weights training doesn't seem to increase any postural control change, so it limits proprioceptive challenges, and within this what you're looking at doing is probably decreasing your spatial awareness and your overall muscle control to fix any slight movements through your core. What you would look at trying to do is increasing your strength training to increase proprioceptive training, so wobble boards, Duradiscs, inflatable foot pods, inclusive of single leg exercises and static balance movements. And what the research has found is that this should also be functional and movement orientated, so that you're challenging your proprioceptive muscles. The data that we found showed that vision was an essential to maintaining the postural control. With this, what we're looking at establishing here is that with vision, you're able to maintain a horizon, so your body's able to equalize and create and establish an equilibrium between its left and its right side. And once this visual sensory input's removed, your body is very reliant on its proprioceptive functions through other senses, and if these aren't trained because you're using your vision too much, what you'll find is that your overall functional ability to correct any postural changes is decreased. So with this, within our discussion, I'm looking at basically developing balancing through your dominant and both your dominant and non-dominant limbs. What this will help to do is enhance the joint position, so through your knees and through your ankles, and also your hip control. This will also help establish greater muscle control, which will reduce your risk of injury through your knees, ankles and hips whilst you're playing sport or completing everyday tasks. And this will create a better result overall for the participants. So, summarising the points, we found the balance is determined by vision. It's also helped through contributing factors of your vestibular system and your proprioceptive system, so your proprioceptive receptors, which help muscle control. Your balance is very important through sports and everyday activities, walking, athletics, AFL, dancing, any sort of contact sports where you can get collisions from various angles. Vision plays a vital role, so maintaining correct vision, so establishing 20/20 vision or increasing your vision through the use of glasses or contact lenses to improve your visual input, and also looking at trying to increase your proprioceptive training, so the implementation of wobble boards, duradiscs, single leg exercises that are functional, and this will help create greater muscle control, better joint position, and an overall better outcome for the patients who are looking at trying to improve or maintain their balance overall.